I have worked for community for 25 years. 24 of those years have been in women's and children's in various roles. I had mammograms in the past, and I had been going on a regular basis. With the pandemic, I think like a lot of women, I neglected my own health care, and I was working in healthcare, so there were some long, busy days here at the hospital, and it just wasn't on my list of things to do for a long time. And before I knew it, 3 years had passed. Finally scheduled that mammogram, then had the ultrasound, then had the biopsy. And 2 days after my biopsy, I got the results that it was positive for cancer. She said, "You need to see a breast surgeon right away. I'm going to put the referral in today. You can expect a call today or tomorrow from him." They weren't doing me any favors. They didn't know who I was. I'd never worked with any of them. And from the response from the physicians to the navigators to just the frequent messages in my chart, like I never went very long at all without an answer to a question. And that kind of attentiveness and responsiveness was the most impressive thing throughout the whole process. Not just the way that they responded to me, but the way they responded to my husband. To have like these very highly skilled physicians be able to talk to him and take the time and be so patient and answer his questions. And every time I had an appointment, to have them look not just at me, but at him and make sure before they left the room, did I have any questions? Did he have any questions? They were that responsive to me, and I know I wasn't their most complicated patient. I was probably their least complicated patient. That really spoke volumes to me. Just from September to December, when the final pathology came back from my surgery, the cancer was more advanced than we were expecting. So it had started to spread. Thankfully, they got it all, and I still didn't need chemo or radiation, but had I not had that mammogram, it would have been spreading for a year, and then it would have been, it could have been life-threatening at that point. Mammograms at community, they're quick, they're very efficient. You can schedule an appointment and be in and out of here in 30 minutes. You go in and you have a private dressing room, they give you a gown and everything. You walk right into the room where the machine is, so it's very private. Like you don't even have to walk through the hallway with a patient gown on. And then when you're done, they release you from there and you just walk out. They make it simple.
Stop breathing.
It's not as bad, I think, as some people have it in their mind if they've never been through it. Putting it off, it's not an option. And I think that's why I talk about it so publicly, because I work in healthcare. I know better. I should have been doing it, and I didn't. So if I didn't do it, I know there's people out there who are skipping their mammograms too and should be getting them. And, that screening and prevention is key.